at one day I just found out that my friends started to work for some, I don't know, weird Dutch guy who came to Russia and who said that we should do some HIV prevention in this country. And we should work with drug users because drug users will be the first group who will get HIV. And of course my friends were so like, skeptical about it. We don't have HIV here. We never, HIV is something in Africa. Some sailor in Russia, like in Kaliningrad, he's got HIV. But in Moscow, we don't have HIV. So people were kind of like, skeptical. But at the same time, like, whatever, Dutch guys, they give us money, they feed us, lunch. We have a nice office, we can work there, and we can just for talking with our friends, drug users. So it was like, when we started to work, we were all excited, and like it was a great team of people. It was back in '97, and I came in as like more focusing on like street work and health work in '98. But we didn't have HIV problem back then. It was really like in Moscow. I remember we read a paper, it was like, 50 HIV cases registered in Moscow. So it was really small. I mean, Moscow is like city of 15, million people. Yeah, and we worked with drug. It was the first outreach program. And it was like the weird Dutch guy was our mutual friend with Ben Mordeville from the Dutch section on of Medicine Sans Frontiers. So actually Medicine Sans Frontiers, they knew that, drugs are on the rise, and it was, shortly after the drug market opened in Russia. We didn't have so many, especially injecting drugs when it was Soviet Union. And in early 90s, suddenly we are starting to have a lot of drugs coming into the country, through the country. A lot of young people get excited about it. A lot of like injection drug uses going on. And Medicine Sans Frontiers decided to intervene. Especially they thought this is such a great area to get involved now, because if we can start the effective prevention programs now, they will not have the HIV epidemics. So it's kind of, exciting. But for some reason, from the very beginning, especially the Moscow city health authorities, they didn't mind the outreach and like talking to people about HIV and so on. But for some reason, they really resisted the component of needle and syringes, needle and syringe exchange or needle and syringe distribution, which is actually the key to prevention. So we already by that time we had, quite overwhelming evidence behind needle and syringe programs internationally. And we already had countries like Australia or some countries in Europe where they managed to stop the HIV epidemic from the very beginning. But for some reason, this evidence was not convincing for the Moscow health officials, and they really, like they said, the moment you give out the first needle, you are out of this country. And of course, for MSF, it was important to keep the presence, and it was important to do at least what they could do. And they decided to start a training program for doctors from other cities. And in '97, they started a great program supported by the Open Society Foundation, the Soros Foundation, and the expectation was that we will train these doctors and like NGO people from, I think, by the end of the program, we trained about 80 cities. So we'd invite someone who focuses on HIV, someone who focuses on drugs, and an NGO worker to this training. We'll provide all the information. It was like 2 weeks intensive training program. And people got excited, and the OSI, the Soros Foundation, they gave these people money to run the pilot programs. And back then we started about 40 needle and syringe programs throughout the country. And there was always like a lot of optimism. Like OSI, they thought that, okay, we do this for 1 year, then we'll see the results. Then the second year, the government will see the results. Then the third year, the government will take over these programs. They will see how great they are, how they attract drug users, and they will start funding them. So that was like a time of like great expectations and great hopes that we will be actually able to stop HIV in this country. But after 3 years, and actually this training program was supported by the Ministry of Health. They didn't give any like money, but at least they allowed their people to come to the training, to take 2 weeks from job and come to Moscow and to implement the harm reduction program, some of them based on in the governmental, AIDS centers or drug treatment centers and so on. So the ministry was not like opposing it, but they were not giving any basically money for it. And they were always saying, yeah, let's see how it works. So there were some evaluations, and actually we found that these programs are working very well. And after the Soros Foundation, there were other donors. Like we had also very big and very like inspired effort by the UK Department for International Development, DFID. They also said that we will support this harm reduction until the government is ready to fund it. And they supported also about 40 programs throughout Russia. It still was very like tiny attempts, because like if you've got city of 2, 3, 4 million and you've got a small program run by, I don't know, 3 or 4 outreach workers, some health specialists, of course you're not going to do much difference, but as a pilot program it may work. And they were quite successful and very, everybody liked them, drug users liked them, the health officials, and who understood these programs, and the health personnel who ran this program, they really loved it. So DFID funded this for another 3 years, and they wanted to have, as opposed to this tiny pilots, they wanted to have large scale-up programs in 2 oblasts of Russia, 2 regions, and there were negotiations to like show the effect of a scaled-up, proper, comprehensive intervention. But then, Iraq and DFID changed its priorities. They like take all the money away from Russia, and they say, okay, now it's up to the World Bank to fund this and to the government. And that was the time when we started to slightly lose this optimism that it will happen just as soon as governments see how great this work is and how we manage to lower the risk behavior among people. They will take these projects. And somehow 5 years passed, we start to think maybe, for some reason the government is not as excited as ourselves. And we did a lot of advocacy work, advocacy, education. So we did this, not us, but international partners. They did this research into effectiveness of harm reduction programs. So to see that they're not working in Australia, but also in Russia. And we had every week we would have some round table with Duma members, with health officials, with this or that. All the Ministry of Health, I think they traveled to every country in the world to see how great, their programming is. And there was a period of this, enhanced advocacy work and education for decision makers. And at some point, the Global Fund, I don't know, you probably heard about the Global Fund to fight AIDS, tuberculosis, and malaria. This is a major effort of UN and the countries to consolidate their efforts and the money, and to give money to the poorer country to fight the epidemics. And at some point, the Global Fund also started to fund programs in Russia. And that's actually the period between 2005 and 2010 when we had probably the most programs all over the country. And by 2009, we had the rise of expectations. We had a change in the Ministry of Health, and the new minister spoke at the International AIDS Conference, Regional AIDS Conference, and she said, it's great that we are funded by the Global Fund, we use this money, thank you very much, but now we don't need the money because we have enough capacities and enough money ourselves, and we will continue all the programs previously funded by the Global Fund. And that was not only prevention, that was already antiretroviral treatment, tuberculosis treatment. So she just like made this promise. So everybody, of course, applauds and loves her, and she becomes the star of all the, AIDS and TB community. And everybody celebrates the success of our advocacy work. So the question is just when and how they are going to actually support these programs. And suddenly, a year later, the same very Minister of Health talks in front of the President and the Prime Minister of the country at the Security Council. And suddenly she says, yes, we will be doing HIV treatment, of course, but there will be no harm reduction programs, because actually the evaluation of these programs showed that the programs were not effective in Russia. And in the cities where these programs existed, they actually have more HIV cases. I mean, the story is, of course, if you have a harm reduction program and you go to the community, you have more detection of cases. And yes, it's quite like obvious result and a good result of harm reduction work, but the ministry found the excuse to just turn their back to harm reduction programs and start to actually not to start actually opposition to these programs, like political opposition. So, and at the same time, I should say that from the very beginning, like while we had some chance to develop this needle and syringe programs, from the very beginning, another important intervention recommended by the World Health Organization and UN Office on Drugs and Crimes as the essential approach to drug treatment, opioid substitution treatment with methadone and buprenorphine, which is just like putting people who are dependent on illegal drugs, like heroin, for example, bringing them to hospitals and providing them with substitution drug, like methadone. So people don't have to, like, involve in criminal activities, they don't have to inject, they can just take oral methadone, and they don't have to look for drugs or money to buy drugs, they can get a job or whatever and start taking care of their health. But from the very beginning, these programs were not legal in Russia. And again, if in 1997, 98, there was hope and even discussion with the Ministry of Health and within the Ministry of Health how we can start the pilots of the substitution treatment programs. By mid-2000, it was already unspeakable. There was like no way the government is going to support this programs, whatever happens, whatever like, sophisticated advocacy, policy, studies, whatever, nothing worked. There was very strong opposition to these programs. I still don't understand completely why. Anyway, so this is like the two components, the main components recommended by the WHO to prevent HIV epidemic. And both of them failed in Russia. The first never worked, the other one started to be implemented and raised our expectation, but after all, it just like stopped. And this year, the Global Fund is still supporting some of the harm reduction programs in Russia, but actually now Russia doesn't want to take the money of the Global Fund because, it's like the G8 country. We just moved to the high-income countries, the criteria of the World Bank. We were upper middle income country, now we're a high income country. So now actually we don't want to take any, you probably heard that USAID was kicked out of the country for the same very reason, like, go to Canada, why do you want to help us? So we don't want your, we have more money than you guys and more like, technical capacities, whatever. So, and now this is like the policy with all the international organizations. UNAIDS closed its country office in Russia, and WHO is still there, but like 2 people. So with all UN, there was big problems, and the problems of this nature that we don't need the international help now. Russia will be actually providing international help, and Russia came up with what is called Rus aid. So now it is giving money to the Central Asian countries, and just I was in Hanoi a week before, and I talked to my colleagues from the Central Asia, and actually in Central Asia, amazingly enough, they managed to develop all these interventions that we didn't have, like substitution treatment, needle and syringe programs. They had a lot of international support, technical support, and they actually, in some countries, they have really good results. Even in Ukraine, who had like huge HIV epidemic, who had like the worst probably epidemic of tuberculosis in people with HIV. Now, if you look at the statistics and like epidemiological curve of the epidemic in Ukraine and in Russia, it goes like this in Ukraine. Okay, how do I show it? So, let's say this is Ukraine, this is Russia. Right, if you look at the new HIV cases. So actually, by implementing these harm reduction programs all over the country, they did manage to take this epidemic under control. They have substitution, not enough for everyone, but at least they have in hospitals for TB treatment and so on. They have needle and syringe programs everywhere. They invested a lot of money, or the Global Fund money, into HIV prevention, and they actually achieved the results. And the same in Central Asia. So now Ukraine and Central Asia and former Soviet Union countries, they're afraid that Russia will bring the money to these countries, but also will insist on stopping these effective interventions. And the Russia's approach like within the country is use a lot of money but don't do anything. It's like the Russian know-how, and you really like, if you want to do this ever in your life, work in like health, you know, and utilize huge amounts of money, but not have any result on the ground, and come learn from the Russian history. Yeah, like just to give an example, now we have a tender for HIV prevention. It's about $6 million. And it's supposed to fund HIV prevention work in Russia in 2013. So I understand now it's like